How do you recognize and manage diabetes caused by immune checkpoint inhibitors? What should patients be on the lookout for? In general, patients undergoing checkpoint inhibitors can affect any organ by causing inflammation throughout the body. This includes glands that produce hormones that can cause diabetes. Some signs and symptoms of diabetes that you should watch out for are increased thirst, increased urination, general weakness, vomiting, abdominal pain, dry skin, dry mouth, increased heart rate, or fruity odor on the breath. It is very important to tell your provider right away if you develop symptoms of diabetes and to have regular follow-up. Diabetes is usually managed by either giving oral diabetes medication and/or insulin. Often an endocrinologist can be involved who are physicians who specialize in diabetes. Patients who develop diabetes while on immunotherapy usually become type 1 diabetic, and generally insulin is given to manage. However, those patients who have history of type 2 diabetes can also be on oral diabetes medications. How is medications for diabetes generally managed? Well, people who are on insulin check blood sugars before meals, after meals, and at bedtime. Depending on number during this time, patient is given what's called a sliding scale of insulin. This usually is the amount of insulin that your physician would like you to take when you get the result of your blood sugar check. The insulin is given by a small syringe and placed in a subcutaneous area such as the abdomen, thigh, or back of upper arm. Patients are given instructions that if blood sugar levels are low, and especially if symptomatic with such things as dizziness or lightheadedness, to consume sugar water or juice. Patients should also watch for signs and symptoms of high sugars, which can include confusion, vomiting, usually more than once, diarrhea, trouble breathing, loss of appetite, weakness and fatigue, or fruity odor on the breath. Some positive notes about diabetes is this usually can be managed and keep patients on checkpoint inhibitor therapy. While this often becomes a lifelong condition, it is very manageable.